free side. You like TV, I'll give you a free TV. Whatever you like for free, I'll give you. Very rarely do politicians talk about healthcare, first of all. Even when they do talk about healthcare, the problem is they don't talk about public health. They talk about building specific infrastructure. So, for example, they say, okay, I'll give you free insurance or I'll build a hospital for you. As per the author, these problems will not be able to resolve the public health issue. Now, the public health issues usually occur much more in developing countries and in least developed countries. The reason being that most of these issues, look at COVID-19, malaria, dengue, most of these issues are directly related to the hygiene, directly related to how you are living, the surroundings that you have. That is why these are the cases that usually occur in developing
ए
countries.
सुनिए ना, एक काम कर
People don't
दीजिए,
have enough
इधर वाला
money,
लाइट जला दीजिए, तो बहुत
cleanliness
कम
is
लाइट
not
आ
up
रही
to
है.
the mark. Unfortunately, politicians don't talk about that. For example, if you look at medical universities across the world, even in many countries, there
थोड़ा
are
पानी मुझे भी
courses
चाहिए.
specially for public health.
खत्म हो गया.
So when you are, let's say, studying medicine, most people, when they say I'm studying medicine, you would assume, oh, they are going to become a doctor of a specific specialty, right? They might be able to become a cardiologist, they might be able to become, let's say, a pediatrician, a gynecologist, whatever. But when someone says I'm pursuing medicine, you don't imagine that, oh, they are studying public health, because this is something
कोना की भाग गया.
that's a bit of a neglected field. Because you think that when you're studying medicine, you would want to cure individual
अमीर
patients.
आदमी से
That is why public health has been neglected. Even when the COVID-19 crisis hit, and when the government formed a big task force of doctors to advise the government, even in that task force, most of the people who were appointed were specific doctors. They were not public health experts. Please understand, there is a difference between public health experts and doctors that can treat specific cases. Public health experts have to think from the point of view of a much broader society. The guidelines that they make, the suggestions that they make are from the perspective of a larger society. As per the author, this is where we are lacking. As per the author, the politicians also, they don't really focus on public health. And the reason is also because that has never been a priority in the country. Whenever you talk to people and they want better healthcare facilities, they talk about having a better hospital, etc. They talk about having, let's say, free hospital. But no one in their right mind would tell the government that I'll vote for you if you improve the public health infrastructure. And that is where the problem is. A lot of diseases such as polio, neonatal tetanus, smallpox, although it has been eradicated, measles, etc., are all related to sanitation. The government focuses a lot on building hospitals, on appointing doctors, but the problem is that our focus on hygiene and sanitation has not been up to the mark. Also, whenever you make these politicians or whenever you see these speeches, I said earlier, they talk about new hospitals, etc., but they don't really talk about having a specific, generic, better public health system. That is why the governments focus a lot on building vaccines. The governments focus a lot.
वेलकम.